Hi, my name is Tyler Isom, and I chose a spinal cord stimulator for my technical brochure. Spinal cord stimulator is something that I'm somewhat familiar with. I've had a few back surgeries over the years, and a few different doctors have proposed the spinal cord stimulator. The last one was the neurologist that was trying to mitigate some of the nerve damage that I have at L5 that radiates down both legs. You get some pretty gnarly back pain some days, and she was pretty adamant that that was the only way to mitigate any of the back pain since the epidurals and the rhizotomies, the nerve burnings, those were all failed attempts to try to mitigate any of that. Um, the spinal cord stimulator is a small, conventional, implantable pulse generator that is battery operated. The battery operated ones actually require an additional surgery to replace the batteries, which is not preferable by some people. Um, the conventional ones that are battery operated, the signal strength is actually significantly lower, and it is typically used for pain in just one part of the body. So just like your low back or just radiating down your leg, not both legs. The rechargeable unit is similar, but it doesn't require the additional surgery, which is significantly more preferable. The electrical strength in the rechargeable unit is more of a higher output and is farther reaching in your body, so it has the ability to run down both legs or to hit uh, two body parts at one time and therefore mitigate more pain and help the patient out in more ways than one, basically. There is an older version of the stimulator that is rarely used today because of the two previously mentioned designs. This radio frequency stimulator actually used external batteries outside of your body, which was significantly less preferable by anybody, even today. How it works is there is a small outpatient procedure with a same-day discharge, provided everything goes good and you meet the criteria. Two small wires are placed along your spinal cord and the vertebrae, and they're connected to a battery pack that is also attached underneath your skin. It's about the size of a matchbook. Some's placed in the front, some's placed in the back, just underneath your belt line. That's also connected to a wireless controller or a programmer, so the patient can control the signal coming from the stimulator uh, as they need to. It's you can turn it on and off as well. Not not recommended to have on while driving, just because of the nature of the whole thing and disrupting everything in general, your driving patterns, your jerking, jolting. The device gives off a mild electrical pulse that disrupts the pain signals being sent to your brain, therefore counteracting any of the signals and telling your body that you're in pain. The spinal cord stimulators have been used for patients that suffer from basically chronic back pain. Back pain can come from many different reasons, whether it's neuropathy or you've got the complex regional pain syndrome. It's just a bunch of failed back surgeries that you have, the isometric pain, or you have some sort of spinal cord injury. It can help you get portions of your life back that you never thought that you would be able to come back to. Um, you can improve your mood, your sleep patterns. Um, it can help you get a lot of portions of your life back, just not being in that daily reoccurring loop of pain. Um, Having the actual implanted device in your body, uh, they've come a long ways. They're compatible with an MRI machine, but it always needs to be double checked with your doctor. The newer ones are more compatible than the old ones. They have them from 1.5T all the way up to 3T for MRI access. X-ray and CT scans are also generally safe, but that you should always consult your doctor with them. You're always going to get set off by when walking through a metal detector, but you will always have a card similar to like having a pacemaker or anything else implanted in your body. You'll have a card that you can provide at the TSA or wherever you're at being questioned that says what the deal is and why you have it. There's also the factor of removal. If the compatibility just isn't working for you and you're not getting the 47 to 74% relief that most of the people get, there is a small portion of the people that actually do have these removed, so it's not a total permanent fixture in your body.